Hi, my name is Michael Rea, and today I will be talking about valvular disease. Valvular disease is when one of the four heart valves, either the mitral, aortic, tricuspid, or the pulmonary, is either damaged or defective. And there's two main types of valvular disease. There's valvular stenosis and valvular insufficiency. Valvular insufficiency is when heart valves fail to prevent the backflow of blood during contraction. Um, Valvular stenosis is when the valve becomes too narrow or too hard from excess scar tissue. Both of them have the potential to eventually lead to heart failure because both of them force the heart to work harder and it causes the heart to strain to pump blood throughout the body. Symptoms of valvular disease are heart palpitations, fatigue, dizziness, fainting, fever, and rapid weight gain. The causes of valvular disease is uh, obviously your age. When you're older, you have a higher chance of getting a valvular disease. Rheumatic fever, infection, also known as bacterial endocarditis, high blood pressure, a heart attack can lead to valvular disease, carcinoid tumors, rheumatoid arthritis has a connection to valvular disease, systemic lupus, erythematosus, syphilis, um, side effects of medication, and radioactive therapy from patients with cancer has been linked to contraction of valvular disease. Um, There are many ways to go about preventing valvular disease. Some tips are to avoid smoking, to not consume more than 2 alcoholic beverages a day, to eat healthy, adhere to a prescribed treatment program suggested by a doctor, and if you're diabetic, to maintain control of your blood sugar. Two mainly used tests by doctors to determine if you have valvular disease is an electrocardiogram, also known as an EKG, and stress testing. Electrocardiogram is probably the most known way of determining if you have valvular disease. An EKG measures the electrical activity in the heart, so it can basically it kind of listens to your heartbeat. And then stress testing is basically a doctor or a couple doctors will put the patient on a treadmill, and they will closely monitor patient's heart. Other treatments include having a heart healthy lifestyle, which means to avoid certain foods and work out regularly. Doctors many times will use the watch and wait policy, which basically means they're just waiting for something to happen to where it's either chest pains or maybe even a heart attack, if they're going to go that far. Um, Antibiotics will be prescribed to a patient for either a short term or a long term. Um, Medications will include a clot preventing medication, an anticoagulant, which is basically a blood thinner, um, and a balloon dilation, which is when a doctor will insert a small balloon into the patient's heart and blow it up to open up the valves. And valve surgery is possibly the most effective. uh, Thank you.